Hello and welcome to our channel Nuturemite, where we provide informative videos regarding health and lifestyle. Please like, share and subscribe the channel and click on the bell icon for important notification and videos.
It is normal for parents to worry about their growing teen's health. Well, these are the years that they develop, that they make their own decisions and become independent. Parents do need to worry, but not to an extent of curbing their freedom. Now, parents need to know the health risks that teenagers face and discuss them together. Our teens must also be well informed, well equipped, and also make healthy choices for his or her own living. At the same time, you parents will also feel, some peace of mind. At this growing age, teenagers face a number of ups and downs. The very important one is with their health. Why is it important? It is important because these growing years will make the path for them to lead their lives on. The decisions they make today are most likely to affect them in the future. So we might as well make healthy decisions. And which is why we have our top 7 health risks that teenagers face today. Accidents. Motor vehicle accidents are the leading cause of deaths in various countries. The Center for Disease Control and Prevention (CDC) estimates that every day 7 to 8 teens between the age of 16 to 19 dies from motor vehicle injuries. However, you must educate yourself and your child about the actual risks and also talk to them and create a plan to ensure that your teenager is going to be safe behind the wheel and you will reduce the risk of an accident. This will help them to be more open with you and also make informed decisions. Suicide. Suicide is the second leading cause for death in teens. Approximately 1 in 11 high school students attempt suicide. During the time, suicide rates have risen over 30% among teen boys and they doubled among teen girls, hitting all-time to the 40-year record. Moreover, many teens may have suicidal thoughts but may not act on it, which is why we parents must be very open with them, make them comfortable with us, and also speak about matters that may not be spoken about in a better manner. The contributing facts for suicide among teens are loneliness, depression, family disputes, and substance abuse. The issues are complex and they aren't a result of one or two factors, which is why communication here stands a very good chance. Communication must be there between the parent and the child. The parent must be there for the child and keep a tab on their mental health as well. After all, along with physical health, mental health also amounts for a lot of problems. A lot of teenagers may face depression, but we must be with them at their times, good and bad. As parents, we must always keep in touch with new topics and allow ourselves to be educated. Our teenagers will only be our friends if we are a little up to date. And we must be sure and talk about these sensitive topics fearlessly and politely. So make sure you have a good communication with your teen, because in case of any emergency, they are likely to turn towards you and less likely to engage in risky behaviors or become depressed. And always remind them there's no shame in asking for help. Violence for teens. Violence for teens comes number 3rd in the greatest health risks, as more than 60,000 teens from age 12 to 19 die per year by violence. Teens could face violence potentially in situations like bullying or engaging in bullying behavior themselves. According to CDC, however, you as a parent must educate yourself on the risk factors for teen violence. Again, discuss the uncertainty with your teen and talk about strategies that help your teen to stay safe. Make sure that school and colleges have anti-bullying laws and no one must be bullied. Every child is precious and every child is unique, and always make them feel loved and tell them about it. Teen pregnancy. Teen pregnancy is also known as adolescent pregnancy. It is a pregnancy in a female under 20. However, teens represent only 25% of the sexually experienced population. They represent 50% of all new sexually transmitted disease And approximately we have 20 new cases of sexually transmitted diseases which are occurring in India each year, which is why it is important for us to educate them on various sexual health topics. We must have sex education, they must also encourage it in school, and we advise that children and parents must have a free conversation, educate the children on this topic. It is quite important that they are aware of the risks of becoming infected with HIV as well as gonorrhea, among other STD diseases. And teen pregnancy not only affects the teenager, but also the surroundings and social life. Teen mothers are also more likely to give birth to premature babies. Fathering a child as a teenager can be a frightening and life-changing event. Sexually transmitted diseases in teens. However, as I said before, teens represent only 25% of the sexually experienced population, which is why it is extremely important for teens to be aware of the risk of becoming infected with HIV as well as gonorrhea, among other STDs. Cigarette, alcohol and drugs. Teenagers who are coming of age come in the influence of their peers who are regularly using tobacco products. As a nationwide survey, it reported that 5% of high school students are currently using tobacco products. That is not supposed to be alarming for you, but should help you confront your child about the goods and the bads, about the advantages and disadvantages. The decisions they make now are likely to affect their life in the future. Substance abuse is also a serious risk of teenagers. As we see, the use of tobacco products is linked with several risky behaviors that include the possibility of using alcohol. With roughly half of all high school students reportedly having tried marijuana and 6% having using cocaine at least once in a while, 1/15 have taken prescription medication not prescribed to them and using steroids. According to CDC, more than 4,000 young adults died of an opioid overdose. It might be very intriguing at that age, but as years to come, we see the changes in the child's body. You must look out for change in behavior or depressed behavior and help your child immediately. Eating disorders and overweight or obesity. Looking at our times today, everyone wants to be a zero figure. Studies have shown us that 87% of teens do not eat the recommended 5 servings of fruits and vegetables a day. And more than that, 25% eat more than servings of high-fat products a day. In such a situation, adolescents can develop eating disorders in which they do not eat enough and deliberately starve themselves, which usually results in loss of appetite. As we see, today a number of food joints have opened and children are more likely to eat fast food joints. Some of them may even be victims of body shaming, which is why they may binge vomit. Some of them may try to overeat and become overweight or obese. About 33% of teens do not get enough exercise and 36 are enrolled in daily physical educational programs. These statistics were for you to understand the statistics around the world of how children and teens react. If you as parents feel that you may be in a situation where you do not know how to handle, don't worry. Learn to educate yourself through videos and read up a little and always communicate with your child. While teenagers' health is a major concern for all parents, we understand that they need proper guidance and care, as it is their transformational period. So as I said before, always discuss and interact with your child. Help them become strong and independent.
Thank you. Please like, share and subscribe to the channel. Click on the bell icon for important notifications and videos.